women and girls with disability are human. They have rights and they have potentials. In the past 1 month, and especially in the past 2 weeks, our on-the-field experience and research and conversation with women and girls with disability, especially in Nigeria, and some of our projects across Africa, had indicated that we are still far away from the freedom line. The fact remains that most of African countries has made strategic step, and we have moved ahead in terms of treaties and protocols and disability rights, but the implementation remains weakened. In the past 1 month, we had a conversation with women with disability, both at the rural and at the urban center. We discovered that the situation is basically the same across Nigeria and in few of African countries where we are carrying out our recent researches and talking with women, both at the rural and at the urban centers. The difference is that for some women in the urban centers, they seem to have a little advantage, but they are still far from what it can be when we compare to the possibility that are available. We have discovered, particularly on the part of Center for Disability and Inclusion, as well as African journalists with disability, that there are 4 main categories of these challenges. One is the fact that we are looking at infrastructural challenges, poor infrastructure, and all of that. And when you look at that, under that condition, we discovered that infrastructural challenges has layers. One is accessibility of health reproductive rights. For women with disability is still far away from the reality that we are portraying or our policy wants us to believe. Minus accessibility as infrastructure accessibility. We also discovered that the issue of either communicating, either walking into health facility, transportation, the distance are very much, especially for women who are based in rural environment. The other factor that we have also seen, which we are also saying that is really important, is attitudinal measures of medical or paramedical health providers. We discovered that there's quite a lot of gap when it comes with women with disability assessing their sexual reproductive health rights as against women without disability. And this is the gap, or the gap is more deeper when you look at whether this individual is educated or not, whether they are financially stable or not, because these are 2 factors, critical factors that we have seen: education, literacy, and then their status, whether they have good work or they have access or they actually know their right. So there are quite a lot of biases that we have seen with regards to medical providers like nurses and all of them, doctors and all of that. The communication gap between these is also very, aside from biases that we have seen where they are not treated equally, quite a lot of undertone of exclusion are very visible when an average girl or a woman with disability show up within the medical facility. Also, exclusion in terms of communication is very, very pronounced in some of these medical facility that we could actually look. Then there's that of the society issue. The society issue is always very there. We have the social stigmas and all of that are still there. And we know that we have noticed, because most of the women with disability that we have related with, that we have asked for their opinion, continue to speak out against stigmas and stereotypes. For one, a woman with albinism victim, was saying that the way she's treated, and another one, a woman with leprosy, is the way she was treated when she tried to access. And then the stigma is also always there within the community. It's even worse within the rural community than when you talk about urban community. And like we said, your situation may be diverse if you are literate, if you are educated, if you know your right, and if you are not literate, if you live within the rural communities, not only in Nigeria, but with our experience, with our conversation, with the research we are carrying out, it's very open and it is very clear that the gap is still there for majority of women with disability. And we need to ask the society and the stereotype, even the media too, the way they push this is very ominous, and it gives a person, a woman or a girl with disability, a lot of concern when they feel that they are ostracized, they are not part of the society, or they are second citizen or even third citizen within their own community, within their own environment. The last part that is very important that we've noticed is violence and abuses that we've noticed among as a very vital challenge issue. It's very clear that abuses of sexual reproductive abuses of women with disability or girls with disability, particularly girls with hearing and visual impairment or speech impairment, is very common, especially within the family setting, in the rural setting. You find out that a member of the family or somebody from somewhere, they are exposed to a lot of rape and all of that because of the fear of, oh, when will I get married or who will I get married? So they are exposed to a lot of domestic violence, and sometimes some of their spouses, particularly if they are spouses without disability, they often assume that they are doing a girl or a woman with disability a lot of good by marrying them, and so they lack the opportunity to actually what we have often seen about violence and abuses is the fact that we've seen that quite a lot of women or girls with disability, we've seen that inability, they are not given the power to make choices with their sexual reproductive right decisions. A woman was complaining bitterly that she felt that she's not ready for a child based on her body structure and some of the challenges she's facing. And her husband was complaining that I have done you a lot of good by even marrying you. I have a lot of options. So for that woman, depression sets in and mental health issues associated set in for such individual. Yes, that may not be peculiar to a girl or a woman with disability alone, but the fact remains that when your spouse see you as an object of pity, somebody that you are just favoring, it brings a lot of issues to them. So these are the challenges that we have noticed within the community with regards to sexual reproductive right of women with disability. The challenge is there, and we know that we have a lot of laws that are protecting them. But the fact remains that we cannot continue to overlook this. I think one of the things that we think that government could do is budget. The fact is, there are not enough allocated budgets to issue of women with disability sexual reproductive health rights. Oftentimes, because of their body's peculiarity and structures, they need quite a lot of attention than average girl or woman in the society. And therefore, even in the healthcare and some of these, what we call health insurances, they are not covered. In fact, in one of the states, we don't want to mention the state because we know that this can go global, particularly in Nigeria, and our experience in a country like Ghana, country like Kenya, Sierra Leone, Tanzania, and some of other countries, is the fact that allocated budgets for their peculiarity, particularly in the health insurance sector, we've seen that most of the health issues are not even covered by health insurance. And therefore, in fact, there are some of the health insurance that we have talked to, health insurance or organization that we have talked to, they do not have a concrete health insurance policy or health insurance facility and opportunity, accessibility for women with intellectual or cerebral palsy. Oftentimes, most of the health insurance policy cover only people with mobility or possibly hearing and marks, visual and all of that. Except that if you are educated and you have the money and you have the resources as a person with disability to actually access such health facility or health benefits on your own. So we are saying that it is high time as a call to action. Number one is that government across Nigeria, across Africa, need to begin to look at allocating the right budget to cater for health, not only sexual reproductive health, right, health of person with disability, and make it a priority. And conversation needs to be for CSOs, civil society organization. They have a role here in stepping up conversation around sexual reproductive health of women and girls with disability. This is the role of CSO. One other thing that we think that data is still a major problem, not only in Nigeria, in some of African countries, where each country or each locality may be doing better than others, but the fact remains that they do not even have enough. And if you don't have enough data, it is very, very unlikely that you have enough planning to be able to take care of sexual reproductive right of women and girls with disability, and even people with disability at large. Other factor that we need to call attention to is the fact that the media need to begin to take a strategic position in some of these things. Media need to educate the society. Media need to help the society to change the priority, to change the orientation, the stigmatization, the exclusion that are related to women and girls with society. We need to begin to speak out for this marginalized group across our cities, particularly in the rural environment. And I think also, minus the fact that government need to ensure that there's enough budget, we need to begin to look at data, which is very, very essential. This is part of what we're clamoring for, and this is the foundation of this advocacy, of this challenge. Inclusion, because we at Center for Disability and Inclusion Africa and African Journalists with Disability are more concerned, and we are doing our best as part of African Journalists with Disability to raise some of this concern. Women and girls with disability are human beings. They need to be seen. They need to be. They can't continue. We can't continue to exclude them. They need to be heard, because there's nothing without us. A good society that brings together everybody and take care of the health of everyone will always benefit, because a healthy nation and a healthy human resources will always work better for the development of all. So our charge today is, it is time for everybody to speak up. CSO need to speak up. Media need to speak up. Government need to do its own bit. And the society and the community need to do, especially community leaders in some of our African community, need to begin to speak up. We need to begin to raise the voices against discrimination, against stigmatization, against stereotype. We have moved beyond where a person with disability is seen as a cursed person, or that a God is fighting them. No, they are not. It could be a medical reason. It can be something. And don't forget that we are all one accident away from becoming a person with disability. So on behalf of African Journalists with Disability, as well as Center for Disability Inclusion Africa, this is our thought, this is our campaign, and we wish that we begin to take some other strategic step in ensuring that women and girls with disability have access to and can determine if they actually have, because part of the issue is that they were not allowed to make decision with regards to some of their menstrual issue decision or reproductive decision, whether they actually want a child now or when do they want a child. These are some of the issues that we're raising. And we're going to continue to raise this until we find out that there's a strategic action being taken, because we cannot keep quiet. A society that includes all, particularly in their health, in the health policy, will go further than a society that excludes some. See you and thank you.